Nancy Klimas. I direct the Institute for Neuro-Immune Medicine at Nova Southeastern University, and I also direct the Gulf War illness and chronic fatigue syndrome, myalgic encephalomyelitis research programs at both Nova and at the Miami VA hospital. So I have a lot of experience with post-viral illness. By a lot, I mean more than 30 years. And I've seen tens of thousands of patients. And so while what I'm about to talk about is not always evidence-based, it's certainly experience-based. And I'm going to have to split that hair, because in medicine, we love to come from strong science. But as you know, COVID's a new deal, and there hasn't been enough time yet to do the kind of research that could tell you with absolute certainty what to expect and what to do. So you're going to have to, in this instance, go from a very experienced clinician's gut and sense of experience. So this is what I hear is going on, that in the post-COVID patients, we're calling those people who haven't fully recovered 3 months after they had their acute infection, that there are people that continue to suffer from profound fatigue, a lot of heart racing and drops in blood pressure and exercise or exertion intolerance, the kinds of things that have defined myalgic encephalomyelitis or chronic fatigue syndrome. ME/CFS is an illness that frequently follows a severe viral infection. There's a lot of research in ME/CFS because it goes back now more than 30 years. And this virus they studied the most was the mononucleosis virus. But it would appear that in mononucleosis anyway, about 11% of people are still sick 6 months after their infection. And they present much like I just described: profound fatigue, body pain, exercise intolerance, and so on. In my world, I tend to see patients years after they've been ill. There was this strong sense that if you just intervened earlier, you might have prevented a whole cascade of crummy things that made people stay sick for years. And it's really life-changing. To those of you listening to this video that are sitting at home, feeling really lousy, it's been a few months since you had your COVID infection, you're wondering why you're not better, let me give you some advice. We know that the two driving factors in myalgic encephalomyelitis are inflammation and oxidative stress, or cell energy, called bioenergetics. At a cellular level, the cells that make energy aren't doing it that well. And in fact, they're sort of hibernating or shutting down to protect themselves from the harm that can come at a cellular level from having so much oxidative stress that the cell actually has to die, has to implode. So it reduces the amount of energy it makes. So step one in trying to prevent the consequence of this type of post-viral illness is to take care of oxidative stress and to be aware of what your energy demands are. So I'm going to split this into inflammation and energy. And right now I'm talking energy, all right? At a cellular level, a cell takes oxygen and glucose and throws it into the mitochondrial machine to make ATP, energy. And in the process of making energy, it spits off a couple of electrons that are damaging, free radicals. And so the cell has a whole nother process to clean those up, the antioxidant pathways that grab these free electrons up and recycle all of that back into good, healthy energy. And what we see in the ME/CFS patients is that they have very poor levels of the antioxidants at a cellular level that can do this. And so there's a perfect little figure eight of energy production, one circle, and then a perfectly balanced other circle to grab up those free radicals and recycle them. And when that free radical circle gets smaller, 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 then the energy circle has to get smaller, 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 or you kill the cell. So you have to do something. So one of the most important things you can do is pay attention to antioxidants. Normally, by the time someone's 40, they're already really depleted in antioxidants. But when you've had an aggressive infection like COVID, you're really under oxidative stress, even at a much younger age. And you should take care of that. One is to eat rainbow foods, as they call it, rainbow feeds. Eat dark green vegetables, carrots, red, purple, all the things that have strong and high levels of antioxidants in them. And that is a healthy diet. I mean, this is not the fast food diet of America, but rather go to the green aisle of a grocery store, and that's where you shop, and that's where you stay shopping. Don't go too far afield of that one aisle. So that's one healthy thing to do. But the other thing is to think about the antioxidant supplements that are out there, because some of them are really quite helpful. So let me back up a minute and say that you have oxidative stress in your body, but you also have oxidative stress in your brain. And so we have to worry about what crosses the blood-brain barrier, what gets up into the brain and can help you. And there aren't that many things you can take that aren't foods that cross the blood-brain barrier, but there are a few. And there's one called NAC, N-acetylcysteine, that Dr. Shungu has recently shown crosses the blood-brain barrier in doing imaging studies in ME/CFS patients. And he showed at a dose of 900 milligrams twice a day that he could normalize oxidative antioxidant levels in the brain by imaging. That's pretty impressive. So NAC is cheap, it's easy, you can buy that. Always be careful though what time you dose things like that. If you take them at bedtime, they tend to wake you up, they help your energy production. So you'd rather be doing energy at morning and midday than at bedtime. So NAC is one core antioxidant. Another is CoQ10, and CoQ10 comes in two forms, ubiquinone and ubiquinol. Ubiquinol doesn't require anything of your body to turn it into the thing it needs to be to clean up free radicals. So I recommend Ubiquinol. There's lots of brands of that. I think at Walmart, it's Q-All, it's Super Q, all kinds of brands. But you turn the package around and look at what the ingredients are. They should have that OL ending. If you can't find it, there's some dosing equivalents. Ubiquinol is, you'd like to take at this stage of your illness about 200 milligrams a day in the morning. If you're taking the other kind of CoQ10, the one that's more easily found on the shelf, Ubiquinone, it'd be 600 milligrams. So take a fair amount of that to try to get your stores back up. And then there's every good antioxidant multivitamin has everything else you need, vitamin C and zinc and selenium and all the things that are in that pathway to help clean things up. So a decent antioxidant vitamin with over and above that extra NAC and extra CoQ10. That would be a reasonable antioxidant regimen, but there are lots of good brands. I do say that there are some places you can go for good advice. There's a website called Consumer Labs that pulls things off the shelf and does quality control testing. You would like to use brands that don't use dyes and don't use additives. So there's a lot of labels around that. Pure Encapsulations is one, Source Natural. There's a lot of good brands out there that are trying to reduce your exposure to potentially other toxic stuff that could come in a vitamin. So antioxidants is part one of this. Now, inflammation is the other part. And during the acute infection, inflammation can be so profound that it's causing this very severe pneumonia that you're hearing about in COVID, but it's also causing the hypercoagulable stroke things that are going on, in particularly younger people, young adults that have this infection. So during the acute phase, during COVID, even if you're pretty mild COVID, I'd certainly at least be taking an aspirin every day to try to reduce the risk of a clot happening as a result of COVID. But now you're in the post-COVID recovery period and you're asking yourself, well, do I still have to worry? Well, my answer is, yeah, you should still worry because you're still in an inflammatory state. I haven't heard anything about post-COVID strokes, but we don't know everything yet. So if it's safe enough for you to take an aspirin or a baby aspirin every day to try to prevent any kind of risk of clotting, I would think that a very reasonable piece of advice in the months and perhaps even a year following COVID infection. A baby aspirin's 81 milligrams. And if you're worried about your stomach, they come enteric coated. They come coated so that they dissolve further down in your intestine and not in your stomach. So an enteric 81 milligram baby aspirin. But the inflammatory cascade that's really causing ME/CFS in major ways has to do with inflammatory cytokines like tumor necrosis factor and IL-6 and so on. And so aiming our focus of therapy a little bit upstream of all that, we hit a target called NF-kappa beta. NF-kappa beta is upstream of inflammation and a lot of the cell function things that we see in ME/CFS. So now we go back to less evidence and more experience, or at least reasonable approaches. I always try to tell my patients when I'm working from a strong sense of knowledge, from good data, from good science, and when I'm working from the best I know how to do. This is one of those the best I know how to do moments where we say, okay, we know what kind of inflammation we're dealing with. Now, these are the things that touch those points. On the nutraceutical side, it's curcumin, which comes from the turmeric plant. It's a spice. Glutathione, another potent antioxidant that also happens to touch NF-kappa beta in the right way. Therefore, NAC, the thing I just talked about, which is a glutathione precursor, should also touch that button. So back we go to the NAC being a core recommendation. Okay, but curcumin is another good recommendation, and it comes in many different formulations, but the ones that cross the blood-brain barrier or have some reasonable evidence that they do make good sense. There are some nano curcumin preparations out there, at least 2 of them. And there's others that are formulated in a way that the particles are very small, or they're liposomal. They put them in a little lipid capsule so that they'll cross the blood-brain barrier better. There's a lot of curcumin formulations out there, but curcumin's not a bad anti-inflammatory, aiming at the right target for an ME/CFS-like illness. When you go to a doctor and you ask for an anti-inflammatory, the ones they're used to handing out are called NSAIDs, non-steroidal anti-inflammatories, or steroids, stronger still. They're a little hard to give in the long term because they're so rough on the stomach, and they can cause bleeding. And they can also cause some renal problems, some kidney and liver problems. So they have to be used with some caution in the long term. They're not bad in the short term. They're safe in, like, say, 6 weeks at a time. But they're not that good idea to go on and on for months and months and months. And there's been studies in ME/CFS that showed that they really didn't work very well because they're really targeting the wrong kind of inflammation, something that's actually not all that present in ME/CFS. So they're probably not going to work that well for you, but you can try them, see if they work. But if they don't work, yeah, probably not worth hanging on to. So that total body pain is often something called fibromyalgia. And this is something your doctors actually are familiar with and know how to treat. So it's an important thing to bring up when you see your doctor because they're pretty familiar with it. They're usually, what you do with fibromyalgia is a couple of things. And again, I'm going to emphasize the things your doctor probably won't mention. When you're in a lot of body pain, your muscles get really tightened up. You crouch into, you curl into your pain. And that shortens the muscle groups in your chest wall, in your legs. You tend to be sitting or crouching or curled up in the fetal position. So then when you do a normal stretch out or a normal stand up, you're yanking and pulling and causing these little micro tears. So it's very, very important for a fibromyalgia patient or a person with these kind of chronic pain conditions to do stretches in the morning before they get up and stretches before they go to bed at night so that they don't end up in this every day it gets a little shorter, a little bit tighter, a little bit shorter, a little bit tighter. And now when you stretch out, you're tearing things because those tears themselves can be the focus of a lot of pain. There's no doubt that heat and cold help local pain, and soaking in a tub is useful, or a sauna, very, very useful for that kind of pain. Magnesium in the tub, which is Epsom salts. That's a muscle relaxer, and it absorbs the skin. It's a very nice muscle relaxer. Can, again, release those tightened muscles that so often happen in fibromyalgia. Now, those are the things that aren't drugs that you can do. But there's also the drugs that have now been approved for fibromyalgia. And there's a couple of them. There's one called Cymbalta. Cymbalta is an antidepressant the way it came out, but it turned out this receptor it touches in the brain is also mediating pain. So it's a good central pain, brain pain mediator. There's a cousin, Savella, that does this very similar thing. And it's also good for the central processing of pain. And then there's one called Lyrica. You see it on TV all the time. And it's a seizure medicine that actually touches the way the nerve fibers are transmitting pain, but also in the brain, how that central pain processing happens. So those are 3 FDA-approved drugs for fibromyalgia that are effective. There are a number of cousin drugs that doctors use a lot, and they're fine. They know the toxicity. So here your doctor should play a role. In our clinic, we use a drug called low-dose naltrexone. It's a homeopathically dosed drug, naltrexone, that touches the central brain pain processing by reducing local inflammation in the brain at the site of where pain is signaling. There's a nice little study out of Stanford. If your doctor has questions about that, you could actually Google low-dose naltrexone and fibromyalgia, and you would be getting that to bring into your doctor. Other types of comorbid things, if you already had diabetes and then you got COVID, or you had lung disease and you had COVID, or renal liver disease and so on, these are, COVID is a pretty mighty big inflammatory hit. So it's important that your doctor go back and recheck all those systems. So that brings up a really important point. How do you know if this is ME, myalgic encephalomyelitis, or some sort of organ system damage that's giving you fatigue? You don't unless you look. So it's actually up to your doctor to actually do a pretty good look at your, starting with a physical exam, listening to your lungs and your heart, but perhaps ordering an echocardiogram, pulmonary function test, the things that could have left you with some organ damage post-COVID that needs to be dealt with. Fluctuations in blood pressure are very, very frequent early symptoms of myalgic encephalomyelitis. Our patients often describe it as the very first thing they notice, that they got over their flu, they went back to the classroom, they're sitting at their desk, they got very dizzy, and then they really had trouble getting home safely. That kind of thing wouldn't be an uncommon presentation for that symptom. Or that they never got over their flu, and every time they got up from their bed, they had this racing heart and sense of dizziness, or unable to stand up safely. Underneath all that is a tremendous level of adrenaline being pumped out. So you can imagine what makes your heart race? Adrenaline. Adrenaline is the signal. But normally it has a counterbalance, that the sympathetic and parasympathetic nervous system are on a little seesaw that's just got a little bit of wobble to it. But in this illness is a great big swing, a giant swing up of adrenaline, and then sometimes a giant swing to counterbalance it. Instead of being a nice even keel, you can feel these huge fluctuations that are like a biologic seesaw going on in your body. It's scary. It's probably the scariest symptom in the illness, and there's something you can do to help. One of the things that triggers it, and this is again back to your biology, in your heart, you have something called a stretch receptor, and it can recognize how much blood volume you have. So if you get dehydrated, you do it a lot. Dehydration really drives it. So one thing you can do is not get dehydrated. Simple water's not enough to not be dehydrated. You actually have to add some electrolytes to that. And you don't go overboard on my recommendation. Drinking gallons of water a day is not good for you. But drinking 16 ounces of a fluid that has some electrolytes in it 4 to 6 times a day, not a bad idea. And I'm not talking necessarily Gatorade, but Gatorade-like drug. Coconut water is good. Any kind of juice has got electrolytes in it. So think about fluids you like to drink that sound healthy, that aren't full of blue and green and orange dyes. And that would be helpful. Another thing, though, that this adrenaline excesses come from is back to that whole thing I was talking about before about neuroinflammation and oxidative stress. Where do these signals come from? Your brain. And when your brain is inflamed and your brain's under oxidative stress, you're going to have a lot more weird missed signals. So take care of your brain, take care of your body, reduce the inflammation, reduce the oxidative stress, and that too will help you. Now, when you go to your doctor's got some tricks for this. So normally the doctor just takes your blood pressure when you're sitting there, but the right way to do this is to take a blood pressure and a pulse lying down, and then have the patient stand up for at least 3 minutes and do it again. Then you can get a sense of how widely these things are fluctuating and what kind of signaling is going on. That will impress your doctor a lot if they do that, because if your blood pressure changes more than 20 millimeters, or if your pulse changes more than 20 beats, that's abnormal, and you can do something about it. So pay attention to that symptom and bring it up to the attention of your doctor. The other thing that's probably the most important thing I'm going to say in this little video is what people do the most to make themselves really sick with ME/CFS, or in this case, post-COVID ME/CFS-like illness, is too much. doing too much. I just told you you had a bioenergetics problem. At a cellular level, you don't make energy. So you get up from your illness and you think you can just jump up and do exactly what you did before you became ill, and your body has adjusted to a new baseline, and it doesn't want to help you there because it doesn't have the stuff to do it. So when you ask, you actually damage your body. And what does it do? It crashes you down into bed for days at a time, sometimes weeks. So if you were exercising every day before and now you're, say 8, 10, 12 weeks post-COVID, and you're thinking, well, I'll just get right back to it. And that might work for you. You might be a complete recovery person and you're all done. But if it flies you right into your bed and you're moaning with pain and groaning with miseries afterwards, you did way too much, way too fast. Here's where the voice inside your head matters. You actually have to stop, regroup, and come back at exercise as if you're tremendously deconditioned, like someone who just had a heart attack. You're going to come back with just 5 minutes of effort and see if you tolerate it. Go rest afterwards. And then you don't go to 10 minutes, don't go to 15. Do other little parcels of 5 minutes. 5 minutes and rest, 5 minutes and rest, 5 minutes and rest. And you'll tolerate that much, much better than doing 5, 10, 15, 20 minutes of something. In other words, don't go for endurance. Go for short spurts. When you're up to it, you can do something called interval training where you really push yourself hard in those short spurts. But you don't want to push for endurance, not for a good long time, not until you're pretty confident that you're on the mend, because it can really put you down and it can shove you into a place where you may not recover for months, if not become a long-term ME/CFS patient. So try to give yourself one little mantra, which is pace, pace, pace. My good friend Allison Bested wrote a whole book on pacing. And one of the things she says in there is take a moment to quiet yourself and listen to your body and say, what do you need right now? And if your body says, I need to rest, you need to rest. Go rest. So I think that is probably the most important little piece of advice I'm going to hand out. So rest, eat, take some nutraceuticals that are healthy, listen to your body, and don't come back too fast. Give yourself a chance to fully recover before you come back.